All right, welcome back into another episode of Politics as usual. I am your moderator. I'm not your host for this show. I'm your host for a lot of shows. I'm your moderator for this show, Matt Whitener. Always good to be in the place. We do have your host here, though, one of them at least. We have DeMarco Davidson in the building. DeMarco, what's going on, brother?
Hey, a little bit of everything, brother. It's an honor to be here as well. It's always exciting. And happy Black History Month, Black Excellence Month, as well as Black Futures Month. And today is an extremely important topic because we're talking, especially in the midst of, of the Blackest Month of the year, right? We want to make sure that when we're talking about politics, it's not just about voting, right? And this is what we always share, that if you don't do politics, that's fine, but politics probably do you. And and when we think about politics, there is a huge amount of politics when it comes to health, when it comes to medicine, and when it comes specifically to how Black people actually receive those resources. So I could not think of anybody better than to have on the show than soon to be Dr. Brittany Ferrell. I'm gonna let her give her own credentials because I don't even want to leave anything out. Dr. Ferrell, go let us let us know who you are, Dr. Ferrell.
Well, thank you, DeMarco. I'm really feeling this soon to be almost doctor. Thank you for having me, and happy Black Futures Month. I hope y'all had a good Black Love Day and a good Valentine's Day. I am a St. Louis based this is where I was bred most of my life, organizer and activist. I'm also a registered nurse, public health professional, and now I'm studying to become a nurse scientist. So I'm a nursing PhD student at Washington University in Goldfarb School of Nursing, and I study cumulative chronic stress and birth outcomes. So super excited to be with you here today talking about this super important topic, because you are absolutely right. When it comes to healthcare, when it comes to health, well-being, and healing, all of it, and especially for Black people, especially for poor folks, it is very, very political. And I'm glad that this is a conversation that's being had.
Yeah, absolutely. It's been a topic that's been at the forefront of a lot of people's tongues, especially locally here in the Missouri area of late. I just believe in jumping into things. I believe in getting to the point of where we're at. There's been a lot of talk over the last week or so about the rollout of the COVID-19 vaccine, what it means to get that into the Black community, to get that into spaces that is accessible to people that don't have all of the access to healthcare and the things that means. However, at the same time, it also has been taken all the way to the governor's office, saying why isn't the need matching the supply in the inner cities and in those places in St. Louis and Kansas City. I'll throw to you, and DeMarco, please jump in as well. What do you make of how this initial stage of this vaccine and getting it in front of the people that really need it is going so far?
I mean, I think we saw this coming when the pandemic first started and testing first started rolling out. We saw how some of the very first testing sites were set up in these predominantly white areas that Black folks didn't live in large numbers, didn't really visit and, frequently at all. It wasn't until much later after the pandemic started that they actually set up a testing shop. I think it was a testing site at the Cortex near the Central West End. And we began to see them, pop up in areas that were, more easily accessible by Black folks. But we saw this coming back then. And I think, with the rollout, there has been a lot of conversation around an equitable vaccine rollout. And the reason we're talking about vaccine equity in the same way that we talk about healthcare equity in general, because we know that when it comes to people having the resources that they need to be well, in this particular case, this vaccine, Black folks are going to be the least thought of by people in positions of power, and even when we are thought of, like, I know you all have seen some of those reports about clinics in predominantly Black areas getting vaccines, and the people who are receiving them are people from outside the area, outside those zip codes, who are coming to line up. Lines are wrapping around the building to receive this vaccine. These vaccines are going to majority white folks, majority people who have wealth and who have access to medication. And so I think it's about, yes, there's this inequity in the vaccine rollout, in Black areas and Black people are deprioritized. But then when we are prioritized, there are no rules, nothing put into place to make sure that we are actually protected, and that what is designated for our communities is actually getting delivered to the people who needs it most. And I think that just really speaks to the way that people value Black wellness and Black health overall. And, I think it's very, very disappointing and it's infuriating, but it is not surprising that this is the way that our system is working in this pandemic and with this vaccine rollout. I think, I'm so glad that this is the conversation that we're starting off with. I've been having a lot of conversations around the distrust of the vaccine, because there have been many different conspiracy theories, and also, in addition to those conspiracy theories, like legit concern, apprehension around the vaccine. And I think that this distrust, it's not irrational when you think about the history of Black people and medicine, Black people and public health. And so I think it's really important to recognize that. But I think what's even more important right now is for us to really be clear when we're talking about the distrust that Black people have, and that is in discussion in our communities. It's not so much that this vaccine is experimental at this point. It's more so the real issue is the inaccessibility by Black people. And so one way that we've been trying to change the narrative, me and some of my colleagues, is like really prioritizing talking about the way that Black people are being counted out of the distribution, while also acknowledging the generational trauma from public health. We don't want to put too much on that when that is really not the issue here. The issue is not that they don't want to experiment on Black people with this vaccine. They don't even want us to have easy access to it, And so I think that the way that we're having this conversation today about access is super important. And when we're also having this conversation about access, we have to be real about some of the hearsay that we're getting from the streets.
Most definitely, Brittany, I wholeheartedly agree, especially when it comes to recognizing the distrust from the medical community for generations, right? So, and even beyond before the ski experiments, many people like bringing it up, but it was different things going on, like of course, during slavery, things of that nature. And I also recognize, and as often as possible, I try to bring up Nurse Judy Wilson Griffin, the first person who passed away from the complications of COVID in the county, and then Jasmine Dixon, the first in the city, both Black women. And it shows also to me, again, I do not know their income, wealth status. I don't know that. I don't know middle class. I don't know any of that. But to know that the impact of COVID immediately started ripping apart families, ripping apart Black families first. And it really, we saw how things changed when St. Charles started getting hit harder. That's when the governors or the mayors or different people started paying a little more attention. And again, with the vaccine, to my understanding, my limited understanding, was already being worked on even before COVID actually came about. And even the process of, actually, I'll ask Brittany, if this vaccine is different than the typical like flu vaccine, right? It's not just giving somebody a strand of a flu virus. This is different. Can you break down the difference in what the vaccine is?
Well, I'm not an expert in,
Okay.
in this area, but what I do know is that yes, it is different. They use, I think it's the mRNA
Yeah.
vaccination, where it's not so much them administering a deadened virus like they would with most vaccines. I think it's just like a replication of um, the like structure of the actual virus itself that helps you
Mhm.
to build some type of um, immunity to the virus. And so it is very different, and that is actually, the basis of a lot of the conspiracies, thinking that because it's this kind of vaccine that it will alter the human's DNA, and which is false. So very different. And I think that a lot of the concerns just lie in the lack of understanding about this particular kind of vaccine, which
Mhm.
I know that there's a lot of information that exists on it, but also I know that there might be some barriers to the common layperson in terms of the language to be able to access what that all actually means. But yes, what I can say is that the vaccine, even though this is a different kind of vaccine, having looked at a lot of the studies that have come out after the clinical trials, it is safe.
And
Mhm.
I think that the point that you just made there is really important to dive into, though. When you talk about the difference between that balance between conspiracy theory, general apprehension, I think that there's a odd marriage between those two things right now. When you talk about, you hear what I hear a lot of people talk about is this didn't exist, a year ago, but we have a cure for it, but we haven't cured X, Y, and Z thing, and all the time it's been out there. When that's apples to onions. I mean, those are two completely different things. You know what I mean? But that disinformation has really gotten a microphone put on it within the Black community due to some of the things that have happened in the past. But
Mhm.
also because I think that there's an echo chamber that's going on right now due to the pandemic, due to people having to spend more time isolated and being able to kind of select the news that they choose to engage with. And a lot, unfortunately, has grown in this echo chamber of a lot of people that have that apprehension talking to each other, it feels like.
Mhm. Mhm. Yeah, and I mean, let's be real. This vaccine has been highly politicized by our last administration, and that has only like made this entire thing much worse. When you have your country's leadership that is, raising potential concerns about, you know, um, the vaccine. I remember when Donald Trump was in office and he said he probably wasn't going to get that vaccine. You know what I'm saying? And even the concerns that were raised around the virus itself not being real or not being that bad, or it being kind of like the flu. At one point it was like bleach injected into your veins and that would help. And so it's like the way that this virus has been politicized, the way that the vaccine has been politicized was like gas on the fire in terms of these conspiracy theories. I think, you have a community of people that have been all but annihilated, right? And, who have experience at being harmed by medicine, harmed by public health, and then you're in this new situation you've never been in before, where we haven't lived through a pandemic like this before, and it's devastating our communities. And then they have this new vaccine that is different than other vaccines that has been completed, and it's been developed and clinical trials completed in record speed, and then there's not I have not seen any acknowledgement from leadership about, the very legitimate distrust that exists. There has been a lot of the vaccine is 95% safe or 96% safe and effective, or, you know, um, people need to get vaccinated, or there needs to be equity, but no one has actually acknowledged the harms that have been done. And when you don't even do that, how do you expect people to trust anything that you're saying? And how do you expect for these conspiracy theories to not fester and thrive when no one has actually made the attempt to acknowledge the origins of how this even came to be? You know, how these conspiracy theories are even able to survive because of things that have happened in the past. You don't acknowledge that.
Yeah,
Where do you expect to get?
And I'm glad that you said that too, because that brings us to kind of like a crossroad where these worlds have intersected. And I want to get both of your opinions about it. I want to start about it on the political side with you, DeMarco. In the last week, we've seen here locally, Governor, Governor Parson, pointing his finger at Dr. Garza, who's over the St. Louis pandemic response team for calling things out. So in the political theater side of it, and we see what's happening on that end, how do you feel so far about what the response has been in regards to meeting the needs of the Black community from elected officials?
Excellent question. And I'll share this, man. I actually wrote an article that didn't get accepted by the St. Louis American, which is absolutely fine, right? Because I wrote out of a place of anger. But I wrote how COVID was not Trump's Katrina. Like, don't depend on COVID to be a deciding factor, right? As much as Katrina was for George Bush, right? Everybody was like, but at the same time, George Bush was going out of office already, right? After Katrina, and he'd already been elected the second time. So, it was different. While I do truly believe that COVID did make a huge impact on people not going along with the GOP anymore. As we can still see, people are still rocking with Trump, still rocking with the GOP, although they continue to show up like this. And again, I bring this all up because, unfortunately, this is just my opinion. I actually feel that they are okay with Black people dying. They are okay with people in St. Louis City, St. Louis counties, in Kansas City passing away. We're not the constituents. This is why I always bring up when we talk about Missouri and Missouri. When Missouri started getting beat up, that's when they paid attention. When we were getting bombarded, when we were having all these deaths, they still was like, y'all better open them schools, but we not gonna give y'all money. Like, and to me, that's I still count that as terrorism. I don't care what anybody. That's my opinion. And when I see these things happening, when I see elected officials are passing away, and elected officials are catching COVID. Herman Cain, like, passed away, like, and they was like, that's insensitive.
And kept on running that Twitter account like he was alive.
Right, that was crazy. The craziest thing.
And there was absolutely no mention of Herman Cain when election came around. They just was like, all right, gotta get another one. That's when they pulled up the brother from down in Kentucky who was, right, next up type of thing.
Right, and the brother from Georgia. I mean, so when I see things, don't be surprised. I find it interesting. Again, I always give props where props are due. I appreciate the local community here in St. Louis. I'm still a little flabbergasted on why the Urban League is even involved in the distribution of vaccines. Like, that's amazing, but like, they're not a medical organization. That's why, like, again, like, it's interesting. Mask, food, cool. But to know that they are being asked to perform medical duties in urban areas, literally it's Urban League, right? It's baffling to me. And the fact that we even accept that is appalling. At the same time, again, I'm glad that somebody stepped up. But I'm not surprised when I see politicians taking advantage of a situation that eliminates people who will not be voting for them. It's not surprising.
Brittany, I want to ask you the same question, but I kind of want to speak the duality of your background as well. Where you have the activist side, you have the side where you're in concern for the people in the social matter, but you also have the medical background and things like that. So first of all, I want to ask you about community response. How have you felt about that outreach? DeMarco, you talk about the Urban League and things like that. How have you felt about the outreach from the minority associated organizations in the city of St. Louis and how they've gone about diffusing some of that messaging or playing a part in making sure that people's perspective of what needs to be done is followed here?
Hmm. Yeah, I've been in conversation with a few different Black leaders and Black folks who are experts in public health and who work in medicine, who have really been advocating for our communities. I mean, really, it's one thing when you have the knowledge and the expertise and the relationships to be able to advocate and to pull together and lead a task force and to really try to prioritize disproportionately impacted communities, which in our region are Black communities. And it's another thing to have the power to actually do something about it. I have a lot of respect um, for some of the folks that I know who have been leading some of the work that has been happening, who really have been keeping Black communities at the forefront of these conversations when it comes to COVID-19 and vaccine distribution. But where I am very concerned is that no matter how much of an expert, no matter how incredible your work might be in the community, even when it comes to decision makers having the authority and the power to do something about it, I have to agree with DeMarco. Those people do not care if we die, and it's become very clear to me as well. Because if so, we wouldn't have to have this conversation about why our communities aren't getting the things that they need. We have the expertise. We have people who are knowledgeable of the facts. We have people who can run an operation to ensure that vaccines get into the arms of people who need them, who can do the data collection, who can do the evaluations. We have the things and the people that we need. What we don't have is people who have the power to actually move the money, move the resources, and ensure that they get into the communities and stay in the communities who need those resources. And so you really don't have to show me uh, a dozen signs in order for me to see what it is. And I think at this point, what it is about is that unfortunately, our leadership, like on a state level, and they just don't care about about whether we live or die.
It's
And
okay
so
it's okay to use the Kanye line right there. It's okay to say it. I felt it was coming. I felt it in
but
you.
you know what?
Old Kanye, that old Kanye.
I want to, okay, it was different. So yes, I want to say something about this, because I think I'm so glad you brought it up, DeMarco, about leadership not caring, if we live or die. I think what I notice a lot in medicine, and it really just goes back to how medicine is absolutely very political, right? Um, we can come back to COVID-19 if you all want, but I'm gonna talk about abortion laws for a minute, and I'm gonna talk about maternal mortality and care. So what I have been just kind of ruminating on is how in our state, I think ranks 43 or 44 in terms of maternal mortality. We have terrible maternal maternal health outcomes. And, in the country, our country, Black women die at 3 to 4 times the rate. In our state, it's even worse than the national data. And in our state, we have not we, but our state leadership has been trying to outlaw abortion, like many other Republican states, and I'm hesitant to say Republican states because after this election season, you know how that goes. Um, so when I think about that, taking away women's right to choose if they want to have an abortion or not, and to me, what you are declaring at that point is genocide. The reason why is because if Black women are dying at the rate that we are dying in this country and in this state, if a Black woman gets pregnant and she feels she has to choose between her life or having a baby, you know, and let's say she wants to choose saving her own life and getting an abortion, if she can't get that abortion, then what you're telling her is that it's a gamble for you. You know, either you live or you don't live. And what I think about when it comes to these abortion laws is, you know, that Black women are dying at such a high rate, and yet you still think that outlawing abortion is the way to go when you have not even thought to address this disparity. So you're basically telling Black women and Black pregnant people that in so many ways, you don't care if we live or die, either by having to be forced to have a baby when you know that our chances of dying are greater, and having or dying simply because there are no policies. The policies around housing, healthcare, education, all the things they not in our favor, and we not gonna thrive, you know. And so it's in so many ways, I think these forced attempts, the attempts to force labor, forced births, because it's not pro-life, but these attempts at forced births by abolishing abortion, what I get from that is, well, we know the numbers in which Black women are going to die, and no, abortion's not an option. So you take the gamble, and if you make it, great, good luck. And if you don't, oh well, abortions are not available to you, right? When I think about COVID-19 and the response in which it's like, we have the power to distribute these vaccines and to make sure that communities that are getting hit the hardest are getting the care that they need, but we're not going to do that because you're not our constituents. So, you know, it's like, in so many ways, they have told us over and over again, if they have the power to do a thing that could potentially mean hundreds of thousands of us are going to die because you're taking away our choices, or you're taking away our resources, you're taking away things that help us survive and thrive. I mean, the math is adding up. You know, it's like they do these things deliberately, knowing that the outcomes are not going to be in our favor. Why should they care? We're not going to vote for them. We would never want to keep them in office, you know. And so I just pay attention to like how this political symbolism around resources and around decisions that impact our lives, our well-being, our ability to survive and thrive, they seem to all come from this same leadership that shows us time and time again that they do not care whether we live or die. And so that's kind of long-winded. I just wanted to make that connection because
I was about to ask you that anyway, Dr. Ferrell. No, that was actually gonna be my next question, actually. Because I remember reading an article and it said that Black America is dealing with 3 pandemics, of course, COVID, white supremacy, and then misinformation, right? Mm-hmm. And as as of course that we do this work, we involved in activist work, advocacy work, and even me with being involved in churches, I encounter quite a bit around on a religious, theological standpoint. And I always share with people, because this is all I got in trouble on another show as well, Brittany. So that's why I'm glad you're on here. Because I've never heard of a man dying from childbirth. Never heard of a man dying from childbirth. Like, we might have been in shock, right? But we didn't die from childbirth. I don't think it's right for men to be making decisions about women's bodies.
Oh, wait, you were frozen.
Okay. Oh, yeah, I see that now. I see that.
Hold on, wait. It says that my internet is unstable.
It said mine was unstable as well. Matt, I think we all were a little frozen.
Matt, can you hear us?
Yeah.
Okay, Matt, the last thing I heard you say.
Uh-oh.
Yeah, I'm back. I had to change my connection. I had too much running on one thing, so I had to change my connection.
Oh.
Okay, thanks a lot, Matt. I don't remember what I said now, Matt.
You were still recording though.
Yeah, and I know.
Yeah.
No, so I'll repeat it, and then we can like just splice it, cut it, chop it, whatever.
No, you don't have to. It never stopped recording you.
Oh, okay, good. Okay. So one, I want to make sure. Yeah. All right. I've never heard of a man dying from childbirth. So I don't really feel it's ever okay for men to make decisions about women's bodies, first and foremost, especially when it comes to childbirth. And we do deal with sometimes one issue voters, which I think is a cop-out anyway. Now, at the same time, because we are dealing with again, COVID, we're dealing with white supremacy as a pandemic. We've been dealing with that again before America even started. But then also the misinformation, and especially when it comes to, I appreciate you sharing and bringing up the Black mortality rate, especially when it comes to Black women. I personally have lost loved ones who have died in the process of trying to birth a child. And again, it's traumatizing. How some people jump on the bandwagon or jump on the wagon of trying to save children's lives, or even saying, oh, this candidate it receives endorsements from Planned Parenthood. We can't have this candidate. We don't want that person. Like, when it comes to those type of things, Brittany, like what do you normally share, or what do you say to people who attempt to say, oh, Planned Parenthood was created by was it Margaret? I don't remember her name. Who was involved in wanted to do a Black genocide, right? Like they wanted to get rid of all Black people. Like, what are we doing with that, or even recognizing that in 2021?
Okay, so let me just make sure I'm understanding what you're asking.
Okay.
When we're talking about abortion, and the way that I'm hearing you is, sometimes the pushback is that Planned Parenthood originated out of a white woman's desire to control the Black population growth rate, right?
Yeah.
Yes. Yeah. So this is something that I have been in conversation with some fellow Black women scholars about before. When it comes to Margaret Sanger and her intent with Planned Parenthood, it's very, very racist, like most things. Most things back then, and today. So I think that the origin stories of Planned Parenthood did not value Black dignity, life, survival, none of that. And I think that is something that needs to be recognized. And in so many Black feminist spaces, I feel like has been recognized. We have to reckon with that, the past and that reality of how Planned Parenthood came to be. And it does not take away from the fact that Black women, we get to make decisions about our bodies, and we get to make decisions about when, how, and whether we decide to have children, whether we are pregnant at that time or not. Like that, we have that autonomy to be able to do that. It just so happened that Planned Parenthood is one of the largest reproductive health providers in this country, who over time has evolved incredibly, and centers the reproductive health needs of Black women, of LGBTQIA people, and have become one of the most progressive organizations that our community can thrive on to meet not just their abortion health needs, but also many other reproductive health services that are important to our day-to-day lives, and I think for anyone who says that their opposition to abortion or birth control or whatever the case might be, if it's because they are trying to protect children, I have two ways of looking at this. I have like the I through this lens of biology, where it's like that's not a child, like if we're talking about an embryo, so I have, and so we could go down that path, and people will argue with me about at what weeks does a heart start beating. I won't get into all of that right here. Or if you really care about children, then how come every few weeks or so somebody's Black son or Black daughter is getting murdered in their sleep, or for taking their phone out their pocket, or they neck getting stepped on, or our prison system is being overwhelmed by the number of Black bodies that are in there, and our country is profiting in a large number off of these Black bodies that are incarcerated disproportionately.
And Brittany, if I can ask you real quick while you're on that subject right there, and you talk about the amount of Black bodies that are in that environment, the ones that are also being tremendously underserved medically, and we're seeing that in the news right now too, where with the virus and how many Black people are being underserved there, that's not a new event that people are in jail not getting the help that they need from a medical aspect either.
No, not at all. It's not new at all. I think what they, what oftentimes I think people who advocate for saving lives, being pro-life, saving lives, or caring about a human being's life fails to realize is that, do you just stop caring about human lives once that baby is born? Because when it grows into an adolescent and an adult, and let's just say, for these same used to be baby boys and girls and humans that are existing within our carceral system, do you not care about them? Do you not care? Do you care about human life, or do you just not care about Black human life? Do you not care about, do you only care about controlling and subjugating Black bodies? And then when the subjugation begins to look different, when it's no longer controlling whether or not you choose to have a child, when it's no longer controlling whether or not you are have access to prevent yourself from getting pregnant, when it's no longer that is within your control, then that control looks like shackles, that control looks like bullets, that control looks like, other forms of violence to subjugate Black bodies. I think people just need to, people's never going to admit that that's their truth, but what it looks like to me and so many others, when you say that you care about saving children's lives or saving human life, no, you don't. You care about controlling Black people and women's ability to make decisions for our own lives. You care about control, and I think that the sooner we're able to actually name that for what it is, but then we're able to move forward, right, with solutions to ensure that they can't do that shit,
Right.
and we just ain't there yet.
Yeah.
It sounds sexier to say you care about human lives. It sounds better. It sounds more righteous when you can't possibly care about human lives when Black communities look the way that they do and are under-resourced the way that we're under-resourced, can't even get a damn equitable vaccine rollout, but you care about human life, and so
yeah, it's insulting. It's insulting. And I shout out to Representative Prouty. I got this from her. She's like, these people aren't pro-life, they pro-birth. And I add on that I want people to be pro-lifestyle. Life is what you have, style is how you live it. You can't tell me you want these kids to be born, but then cutting the social safety nets, just cutting all those things off, or even cutting the public school budget. And again, this is just recent. Governor Parsons did that when he saw like, oh, y'all not going to school, y'all don't need as much money then, as if our schools are still not serving students. It's so definitely. So therefore, I too always push back on people and saying when women have equitable pay, then maybe then, right? When women can have fewer barriers to education or any of these matters, right? Or even making sure that the opportunities are available. Childcare, like preschool, like early, like, and all these things. And this is always what frustrates me is knowing that the science shows what is needed to have a healthy child that can actually be put into a classroom environment, which we can have this on a discussion another day because I cannot stand standardized tests. Yeah, and when we have these things, it's not we are not utilizing the things that we know that are actually beneficial to eradicating poverty, When poverty is eliminated, like then we can have different discussions. But until then, and I share people with sometimes, again, I don't think there's ever one case fits all, especially when it comes to abortion or even thinking about having an abortion. And I encourage people, family members, if they know somebody, if to have discussions around support of the young lady who's pregnant. But also encourage people to actually look into what it means to possibly have a doula or somebody of that nature as well. So what have you seen, Brittany, that's like some of the things that actually are changing or actually working to save and protect and encourage the development of Black lives, of Black babies, Black women?
Yeah, I would use this opportunity to big up our work at Jamaa Birth Village that's happening. Yeah. A lot of the efforts that I'm seeing and just loving is being led by Black women, and I think it's out of our desire for self-determination. Like Black women and our desire for self-determination means that everybody wins, at some point. And so we've seen it happen with the recent elections, and we're seeing it happen right now in terms of maternal health care. At Jamaa Birth Village, we were just and for those who are listening, I am the chair at Jamaa Birth Village, which is a birthing center in Ferguson, Missouri, which is the epicenter of today's civil rights movement. So it's just super symbolic, right? To have this super incredible Black-led, pro-LGBTQIA birth facility, birth clinic in the heart of the epicenter of today's civil rights movement. To be a part of the work there is incredible. We just received a $1 million grant from Merck and Yellow Chair Foundation. And with this $1 million grant, we are able to really, shift the landscape of maternal health care in our region. So doulas, the role of the doula has become increasingly popular over the past several years, and with good reason. When we are looking at the maternal mortality rate here in this country, what we learned is that people that have doulas have better birth and pregnancy outcomes than people who don't. And the reason why.
Why is that?
Well, the doula plays
like my sister's a doula. So, but I'm like my sister's a doula. She just became one last year. But like, what do they do, and how can somebody become a doula?
Yeah, so doulas are basically birth support people. So they're not clinical. They don't do any clinical work whatsoever. What they do is they support the physical, mental, and emotional health and needs of the pregnant person before pregnancy, in some cases, during pregnancy, during labor, and postpartum. Doulas advocate for their patients. They make sure that their patients are getting proper pain control, that their needs are being responded to appropriately by their doctors and their nurses. Doulas make sure that the calls of Black pregnant people are not going unanswered, which oftentimes happens, which really speaks to the realities of maternal health right now. Doulas are people who in so many ways are saving lives, just by simply providing additional support, being witnesses and advocates at the bedside of pregnant people. And so at Jamaa, with this $1 million grant, we are training 360 doulas. And this is our attempt to make sure that there's a doula out here for everyone, no matter how you identify, no matter what underlying conditions you might have before, during, and after pregnancy, no matter what you're able to afford. We want to make sure that there's doula care available to anyone who wants a doula. And the way that folks can train to become a doula, they have to usually go through an organization. There are so many incredible Black-led organizations all over this country who are now doing doula trainings, and doing like comprehensive doula trainings. It's not just about the you know, the laboring pregnant person. It's about preconception, you know, nutrition. It's about the mental health care needs, you know, and showing up to meet the emotional needs of your clients. It's about addressing the fact that trans and non-binary people get pregnant too. And if you're Black and you're trans or non-binary, you are subjected to the same outcomes, if not worse, being compounded by your identity that Black cisgender women are, you know, that we are subjected to. And, you know, we are attempting to create a new reality for pregnant Black folks here in St. Louis. With the work of Jamaa, we're looking to train men who can show up for their partners as their doula providers. We're looking to train folks across the LGBTQIA, you know, in the community, and trans non-binary people. Call Jamaa Birth Village to get involved. You can go to jamaabirthvillage.org if you're in the St. Louis metropolitan area and you want to become a doula. If you you know, you're listening and you're not from or in St. Louis, look up the closest doula training that's available to you. They're in almost every major city, and see how you can get involved, see how you can get trained to become a doula, because in order for us to change the realities of Black pregnant people in this country, it's going to take all of us, you know, in one way or another. Whether you decide to do that by becoming a doula or simply just knowing, you know, what to look for and how to advocate for your loved ones, you know, having these conversations. A lot of Black folks don't even know the realities of, you know, of maternal mortality rates, you know, and I've heard that so many times. I'm working on this project right now called You Lucky You Got a Mama, and it documents the experiences of Black pregnant people. And when I talk to people about why I'm doing this documentary and why it's important, a lot of times I hear, wow, I didn't even know that was a thing. You know, that's how I actually came up with the title, You Lucky You Got a Mama. I was talking to one of my comrades, Damon Davis, and I was letting him know, like, these are the facts. And he was like, damn, I didn't even know that shit. You lucky you got a mama if you got a mama, you know? And so so it's like, there's a lot of work to be done. And in one way or another, it's gonna take all of us. Simply by knowing is a good place to start, so.
And I feel like an undercurrent of a lot of things that we talked about today. First of all, we're running short on time, so I want to thank you right now for the knowledge that you put in this space today and the things you put out there. Before you go, I definitely want to recount again where people can follow up to get that information at. But on the way out here, I wanted to say, it feels like to me like an undercurrent of the things we talked about, whether it's COVID awareness, the realities of the impacts of politics on it, the realities of Black mortality rates for women that are pregnant. It feels like a lot of what we've talked about today has been either a lack of awareness or a lack of the right way to talk about things, to get people to be knowledgeable of how these health factors are impacting the Black community. If we could tie it together, what do you think are some of the changes that we need to take in the everyday ways that we discuss these things in order to get ourselves moving in a positive direction towards the greater health on the large scale for the Black community?
Mm-hmm. I think that's a very good question. And, you know, I think one thing that I think is super important is knowing who holds what power and who is it that you need to be targeting to get the things that you need. You know, when it comes to power mapping and knowing who needs to be the person at the center of, I don't want to say like your campaign, but if you're developing a strategy, right, we got to figure out how our community is going to get the things that we need. There's usually a person who holds power to help make that happen, that can help in a significant way to make it happen. Power mapping with your folks, getting plugged into an organization, I think is a really great way to learn about how to trace power and how to, being a part of an organization allows us to amass political people power too, which really makes a huge difference in Black people getting what we need in our communities. So I would start there because, yes, consciousness raising and being aware is very, very important. And I don't want to pretend like Black communities are not aware. If we not anything else, in so many ways, we are aware of many, many things. This is about power. This is about power, and it is about political agendas, and it is about using resources to prioritize and to let people know who it is that they care about and who it is that they don't. And so I think when you attack power at the source, you could then, that's when action happens. Like that's when things really start moving. It's when people feel like their power is being threatened. And so I would say that I think Black communities, and I know until I became an organizer, I never thought about power. When you come from a place in which you don't even, you're not oriented to it at all. All you know is that you don't have it. It's like changing the way that we talk about and that we see and recognize power in our city, in our state, in leadership, but also within our own communities. So I would start there, and then after that, I think
You sure you got time, Brittany? I want to hold you, but hey, I hate to cut you off. Like I want to make sure you good.
We are running short on time. I wish I could stay.
Well, we don't.
Chat.
This doesn't have to be a one-time thing. I think that this is such a big conversation that I would most certainly love for you to come back with us, have this conversation with some different elements in place, some different people that also are involved in this. Be with some people that, whose minds we need to move, if that's the way as well. I think it's a huge conversation. And, I definitely think that what you've added today has added a lot for people that might not have thought about it otherwise.
I would love to come back. This has been excellent. I could talk about this all day. So I look forward to coming back and visiting and talking with y'all and,
Most
continuing
definitely. No, thank you.
to do this.
No, thank you so much, Brittany. Again, you were one of my heroes. For those who don't know, I met Brittany in 2014 when she was already organizing some amazing civil disobedience and kept it going for a while, like a long term. Like it wasn't a short thing either. So we got to bring that back and even talk about all the different political as well as health implications when we are going to be activists and advocates and doing this work as well. We got to come back and talk about that next time, because I definitely had some PTSD a couple of nights. I had to ask Starsky for some extra prayer every once in a while. So thank you again. Real fast, you can share whatever information you want. If somebody want to reach out to you or they want to get more about the village as well, share the information real fast and wrap it up.
Of course. So if you want to learn more about Jamaa Birth Village and train to become a doula, visit jamaabirthvillage.org. All the information's on the website. If you want to follow me and keep up with what I'm doing, keep up with the project that I'm working on and other things, because I'm doing a lot right now. The best place to find me is on Twitter. And my handle is pretty long, so I'll have DeMarco and Matt provide that for you all, but it is at Badula Ablangata on Twitter. And so other than that, if you want to reach me, if you want to ask questions, if you want to collaborate, my email address is hellobritney@honorblackbirth.org.
All right. I like that.
All right. And just let any trolls know, don't come after Brittany. It's going to be problems. Let y'all know that right now.
Do not do it to yourself. Don't do it to yourself.
That ain't what you want.
Well, hey, Brittany, thank you so much. And we look forward to you joining us again here on Politics as Usual.
Thank you for having me, y'all. Have a good evening.
Thank you.
All right.